So how does climate change affect health? Well, let me just lay the foundation for the terms of the panel. This diagram made by the US CDC does a great job in illustrating how climate change is linked to health. Okay? We don't say global warming anymore, because climate change is more than just warming. Climate change is manifested by many climate drivers. For example, rising sea levels, increased CO2 levels, rising temperature, more extreme weather events. These climate risks drive a lot of environmental risk factors that are tied to health. For example, pollution, extreme heat, environmental degradation, increasing allergens, water and food supply, water quality impacts. Now, these environmental risk factors are linked to a variety of adverse health outcomes. So it's a multi-layered system. We know some of the linkage better than others, and the climate impact on health varies by region. In our region, in the southeastern United States, we have these more pronounced climate health risks. For example, extreme heat, air pollution, fire danger, harmful algal blooms, shifting disease vector distributions. Now, we know some of them pretty well. These are not new problems. These are problems being exacerbated by climate change. So extreme heat, like Dr. Stone just talked about, it's linked to heat-related illnesses. It's going to make your existing heart conditions worse. And if you don't really take care of yourself, it could result in excess mortality. Air pollution has been pretty well studied. We know it causes respiratory problems, heart problems. These are well-known facts. The lesser-known facts related to air pollution exposure is birth outcomes, developmental issues, reproductive issues, mental health issues, for example. And fires will destroy property, will cause injury and death. Harmful algal blooms will cause you headaches, stomach problems, other food-related illnesses. And the shifting disease vector distributions will change our strategy in dealing with infectious diseases, vector-borne diseases, and other pathogens. So like I said, these are not new problems. They're exacerbated by climate change and also by region-specific socio-demographic factors. For example, the southeastern U.S. is projected to grow. Its population is going to increase quite a bit. By 2050, the projection is the Metro Atlanta region will reach a population of 7.5 million. However, that population growth varies, and it's different in different regions. Most of the growth will happen in urban areas along the coast, but in many rural areas, actually, the population will decline. And the population is aging. The problem with that is when you have more people in the city, you have more people in harm's way. When you have fewer people in the rural areas and an aging population, it shrinks your tax base. You have fewer resources to beef up your infrastructure to deal with the climate impacts. Okay? And there are significant differences in communities' abilities to build resilience and to adapt. For example, the wealthier communities, the younger communities, they have more resources, they can fund and try innovative adaptation projects, beef up their action plans. The smaller and rural communities, they lack funds. They lack the training for their leadership. They lack the ability to advocate for funding. Right? So there's this real disparity going on that affects people's health. And then last but not least, there's long-standing structural racism in our region that resulted in many communities of Black, Indigenous, and people of color that are disproportionately exposed to climate change and with fewer resources to address it. Okay, so as a scientist myself, I pledge my expertise to this sustained effort, this collective effort to fight climate change. As institutions, Emory, Rollins Public Health, we have a lot to offer. For example, this new NIH-funded climate research center called CHART, and I credit NOAA for the iconology, and then the logo, call it the Chart a Healthy Climate Future. We are having a lot of expertise. And the center is composed of environmental scientists, epidemiologists, biostatisticians, behavioral scientists, communicators, community engaged research experts, medical doctors. We have long-standing partnerships with a lot of local organizations. And the center serves also as a bridge to world-class climate scientists and public health leaders. So we are a resource to be shared with our community. And our center aspires to become this knowledge hub that serves the southeastern US, and we advance and translate research on climate risks to protect our community, especially the under-resourced urban populations. Okay. And like I said, climate change is not a local problem, it's a global problem. Climate change is not only a scientific problem, it's also a social, moral, and spiritual problem. Trust me, if climate change is a scientific problem, we would have innovated out of it already. It goes way beyond that. A lot of the answers lie beyond science. For example, do we value our life the same way as we value the lives of strangers, the lives of our next generation, the lives of people living elsewhere in the world? Do we have to change our lifestyle? Do we have to make sacrifices for them? Who gets to decide that? Who's at the table to set policies? How are these policies communicated widely and being discussed in this democratic society? How are these policies implemented by our regulatory agencies effectively so they achieve the design effects? Right? And then last but not least, what is out there to sustain me to stay in this fight? Is that a spiritual question or a scientific question? Right? It goes way beyond science. So I'm going to end right here in the interest of time, and let's hear what our distinguished panel have to say. Thank you very much. I'm told we have to stop at 2:10. It's very unfortunate. We have some beautiful panel here, and I posted a lot of questions without a specific order. Anyone, please, just give a super brief self-introduction and then make your remarks.
Everybody keeps looking this direction. Good afternoon, I'm Janine Gettle. I'm the Regional Administrator for the Environmental Protection Agency here in Atlanta, headquartered here in Atlanta. We cover the 8 southeastern states and 6 tribes. So what EPA is doing right now under the Biden-Harris administration is we are taking on climate change in our communities, particularly in our underserved communities. We have a historic investment in infrastructure. And when we talk about infrastructure at EPA, we don't just mean pipes. We mean helping communities determine how they can address climate change in their communities, how they can use resources from the federal government to put in tree canopies. Tree canopies are important in urban areas, but also in rural areas, how you can reduce runoff into your rivers, lakes, and streams, because that's where you get your harmful algal blooms when you get hot. I think there's no better thought about climate change than if we look outside the windows today. This hurricane spun up in the down in the Gulf faster than I've ever seen a hurricane spin up. It's going to be a major hurricane, and when it hits, we are going to see devastation all across the southeast and all the way up into Kentucky and Tennessee. And so what we're talking about doing is investing in things like solar, investing in greenhouse gas reduction, and we have a historic amount of money to invest, and we're very proud of that. So I'll stop there in the interest of time.
I'll go next. I'm Sheila Andrus. I've worked as a research scientist. I've led the entomological research for the USDA Forest Service. I've administered a Center for Global Health, the Sparkman Center for Global Health at UAB. And these questions that you provided were so thought-provoking, and the first thing that came to mind for me was there's so much good information about the impact of climate change on the health of people, on the health of ecosystems. In 1987, which seems a long time ago but not so long, the Brundtland Report was submitted to the United Nations, and for the very first time, economics, environment, and health were linked together for the United Nations to say, we can't solve a problem in one of these areas without understanding information and conditions in the other two. And from that work, we got the Millennium Development Goals. How many people are familiar with the MDGs? Now we're using the Sustainable Development Goals, 2015 to 2030, we're pushing towards that. And we can turn our attention to the SDGs to have a better understanding of where are we with global health today. And it is a very discouraging picture. The three key factors are climate change, loss of biological diversity, and air pollution. That's the three major factors. And I just want to share a few pieces of information. For women, having women involved in governance, having women be able to work with fair pay, not to be subject to domestic abuse. There are specific goals in the SDGs for women. At the rate we're going now, globally, it will take 130 years to meet the goals for women. We cannot solve the problems of climate change and health without women being more involved, more included, and better protected. We've gone backwards on malaria because of climate change, the progress that we were making with malaria, for example. Education, we're failing globally in terms of education progress for students in math and reading, but also the training of teachers. And education is key to everything that we want to do. We need to have a public that can, think about these problems. One other thing that I wanted to comment on before we go down the line, I guess, and this was a question that came to this panel that asked, what is our perhaps moral or spiritual aspect of dealing with global health? And one of the main things to be mindful of is that in the UN process, there's something called just transition, where the communities, the nation states participating in the UN Conference of Parties on Climate Change are looking at the cost to less developed countries because of the impacts of climate change and all these various factors. $100 billion have been pledged to help less developed countries deal with these impacts. $6 trillion are needed. and we're not meeting our $100 billion pledge. So that's one key piece of where are we morally in this process. But I also came upon a fascinating article by Dr. David Addis, who interviewed 300 global health practitioners about the spiritual aspects of their work. I found this very, very interesting because some of it rang true for me. Some of what he was able to document is for global health practitioners, there's a really important need to remember the faces, not just the numbers. And this is almost a spiritual practice. And I know everyone on this panel, I'm sure, has ways of, not just working with the data sets pertaining to populations, but also re-engaging with the human aspect of this. He found that there was a conspiracy of silence where people who are engaged in science often sort of divide themselves and keep their spiritual practices or traditions to themselves and just try to work with the science. But we're whole beings. And so this is one of the things that was a burden to people, that they felt like they needed to be able to be more in touch with what fed them spiritually. And I think with that, I'll pass. But thank you for the opportunity to share.
Well, I'm not a scientist, I'm a reporter. And I will say that I've been reporting on healthcare in this state and city for 32 years. It's a long time. I've mainly focused on getting care, access to care for people, whether they're uninsured or insured. Looked a lot at hospitals, mental health care, all over the landscape of healthcare. But I've branched out into a couple of times into environmental health, and I've been surprised at one, the level of readership, and two, the impact. We broke news of the soil contamination with lead in the west side of Atlanta, and that got a lot of things mobilized in terms of government and community effort. We also did, with WebMD, a story about air pollution of a cancer-causing gas in Smyrna and Covington, ethylene oxide, and those communities really reacted to that. So when I've gotten into environmental health, I've found the readership is there and sometimes the impact is there. Now let's move to climate change. I haven't touched on this enough in my work, but I can tell you, I work with KFF Health News now, a nonprofit news organization, and we're going to look at this issue. We're going to look at climate change in the South and how it intersects with poverty and race. And we're starting to get some ideas about it now. We've got a great team at KFF Health News. But I don't worry about media coverage of this hurricane, because just about every reporter who's available will be out there with looking at the impacts, whether it's power failures, whether it's just simple loss of life from the storm. But what I think we need to be focusing on is, as the media, is everyday climate change impacts, whether it's an inner city family that has a kid with asthma and they're dealing with the heat and the air pollution that's in their community. I'm thinking about the day laborers and the farm workers in rural Georgia and how they're dealing with August and 100-degree weather. I'm thinking about the flooding in areas, not just the west side, but elsewhere, and what that does in terms of mold in those homes and respiratory disease, but also the spread of mosquito-borne illnesses. And I worry that we do not pay enough attention to things as the media. We look at the headlines, this is the warmest year ever. We look at the headlines, there's more storms than ever before. But are we reporting on the community impact of day-to-day climate change? And whether it's seniors being vulnerable to having their power cut off, or getting access to care. They may not have transportation. They may have to walk a ways to get to a MARTA station in 100-degree heat. I think those are the stories we need to be telling. And I hope in the coming days, we as an organization and the rest of the media can really focus beyond the typical hurricane story and get into the communities and the homes of people here in Atlanta and in Georgia.
Thanks a lot, Steve. It's a great way to put a human face to climate change.
Yes.
No, thanks.
Thank you. I was going to make a very similar point, so instead I'll make a different point, which I'll try to do quickly. And this is, I think, speaks to something we haven't talked a lot about today, which is that although climate change is the greatest public health threat of this coming century, it's also, tackling climate change is often considered the greatest public health opportunity. And that's not discussed enough, and it really is a very powerful idea and a potentially transformative way of making progress, not only on public health, but on health inequities and other social problems related to public health. And the thinking goes like this. It's that if we adopt strong climate policies to reduce greenhouse gas emissions, we have the climate benefit, which of course will help us in many ways. It'll have a public health benefit, it'll have an economic benefit, there'll be social benefits. But those policies can have public health benefits, or co-benefits as we call them, immediately and locally. So if you think about air pollution as the clearest example, if you burn fossil fuels in a car, in a power plant, you cause carbon emissions, which leads to climate change, and you release air pollutants. That means if you shift towards clean energy, you get the climate benefit, but you also get the health co-benefit from improved air quality. And air pollution alone is responsible for something like 5 to 10 million deaths a year worldwide, which is really an astonishing number. So that's an example of this idea of health co-benefits. There are many other examples you can imagine. If we facilitate people traveling more actively, walking and biking, public transportation, you have a climate benefit, but you have a health benefit also because of the physical activity, because of the reductions in air pollution and so on. We see this in diets. If people move towards healthy, more plant-based foods, you get a climate benefit, you get very profound health benefits from that too. So I think we've talked a lot about the scary aspects of climate change, all these impacts that we are facing, that we're going to face. But dealing with climate change is really a transformative opportunity for public health and for other issues as well. So I'll leave it there.
Thanks, Noah. Wouldn't it be wonderful if EPA gets to regulate CO2? Right? All the co-benefits, long-term benefits will be factored into our lawmaking. John, please.
John Berkshire, I'm with the National Association of Chronic Disease Directors. We're a national organization that supports state and territorial health departments in helping them prevent chronic diseases. 7 of 10 people have one or more chronic condition. Like many of you, I think some of us are going to be in the business after this meeting of supporting those communities who are going to be disproportionately affected by this hurricane. And every natural disasters, people with chronic conditions are disproportionately affected. And unfortunately, as our poor and underserved, it is the most vulnerable are affected the most. And one thing I would say to our federal colleagues, including the Center for Disease Control and Prevention, that's also here in headquartered here in Georgia, they are really moving in a very consistent and logical way towards building resiliency. The Biden administration and their infrastructure bill is an amazing benefit. For the first time in a very, very long time, maybe since FDR, there hasn't been this much money put into infrastructure. And I heard I was at the climate change meeting at the UN in New York this week, and they talked, the FEMA director talked a lot about instead of putting money into the federal government's always going to come in behind and support those communities affected by climate change and floods and hurricanes and forest fires. but they're really investing money to build, make sure communities are more resilient. And the resiliency investment is what's going to protect these communities long term. And to your point about, our work is done around building walkable communities, leading people towards healthier lifestyles, better nutrition, more physical activity, making sure people don't smoke. And there's just so many benefits to living a healthier lifestyle and building healthier communities. That is where we should be focusing our money, because it brings equitable change, it supports the most vulnerable populations, and then we really want to, of course, our goal is to move towards a world that's free from the burden of chronic diseases.
Could I?
Thanks a lot, John.
Could I add just one last thing? I just want to add one last thing. So I think it's very important that we talk about the health benefits and the benefits of addressing climate change. But I also want to make sure that when you talk about this, you also talk about the economic benefits. That there are economic benefits that go to sustaining communities, to helping communities long term as we invest in a cleaner climate. We have opportunities to develop new jobs, new opportunities in communities that have been long underserved. And it's an important aspect of talking about this because it resonates with people that might not be as in tune with the health benefits, but the economic benefits are also important.
Well, we brought something called a walkability action to make communities more walkable. And in one of our areas we did this in North Carolina, we brought in $7 million worth of ad business. The businesses, the community business communities around this small city, we're in a rural area, all pitched in, and that by building a more walkable community, they brought in more businesses, they brought in healthcare, lots and lots of things followed.
Yeah, I just talked about a grant that's going out in the southeast where they're using our money to put in a solar farm that'll support a wastewater treatment plant. They're going to take 15% of the return on that energy bill and invest it back into communities. And so that makes a huge economic difference.
Thanks a lot. I'm about to be kicked out.
Then we'll do another discussion for 10 minutes.
Okay, all right, well, let's thank our panelists.